Good afternoon, ladies and gentlemen, dear colleagues. First of all, I would like to thank Dr. Adonogiannakis and Dr. Brilakis for their invitation. I feel honored to participate in such a great event, which keeps surprising us every year with its innovative ideas. And I feel a little bit anxious to have in the chairman Mr. Dr. Adonogiannakis and Mr. Gigoutakis and all the excellent audience. Let me.
I will keep your questions for later.
Let me present you my point of view for our case study, but not to forget to bring the upside down first. This is our case study. My gathering of information starts at the moment the patient calls my secretary. She's trying to give me the first information about the profile of the patient. Of course, a key element is the communication with the doctor who provides his insight about the patient. For example, what took place in the operating room, where to give the most emphasis, precautions, and so on. Don't be surprised that I pay attention from the moment the patient walks in my office. Everything from her facial expression while she gets undressed to the way she needs, if necessary, to be assisted is very important. We should never forget to get an idea about her general condition as well. Please remember not to overlook paying enough time in history taking as well as the information the patient is providing us, even if at first it seems irrelevant. Always be aware of yellow flags and especially red flags. And as Mr. Georgakopoulos said, listen, listen, listen. Thank you very much for that point. A small quiz for all of us. Unfortunately, I can only give you a few seconds to read the quiz and think about the right answer. Keep in mind that there is only one correct option. And the winner is storytelling of the patient activates the prefrontal cortex and the healing process begins. So that should ring a bell regarding the importance of spending time listening to the patient. Listen, listen, listen. It is important to be aware of the doctor's expectation considering the medical treatment of the patient. Additionally, it is good to have discussed with the patient to get a thorough understanding of her expectation. Combining the information from the doctor and our clinical evaluation of the patient, we should gradually build our profile of expectations for her final outcome. One important part of our clinical examination is the detailed observation. You can read all of them. I will just mention that in the observation of cervical and thoracic spine, the examination of movements should also be included. By abdominal breathing, we mean that we are concerned about the diaphragm's movements with its amplitude and frequency. That's why I'm also putting thoracic breathing, but you know that it's not only diaphragm. We talk about triangular movement of respiration and so on. Then we continue with local observation. We are the ones who usually see the patient more often. Thus, all the above are important for our work. Moreover, in some cases, we should inform the doctor and refer to him for evaluation. In this picture, it is the patient who closes her eyes. In reality, we should be the ones capable of palpating the patient even with our eyes closed. I believe all of you are fully capable of performing the physical examination. I just want to point out not to forget the neurological examination. I think that in our patient's case, it is impossible for her to perform such exercise. However, we should aim at getting the best from every patient. I think it requires a lot of effort to resemble such joint mobility. Still, it is our job to assess the mobility of all the surrounding joints and not only the glenohumeral. It is of highest importance to make the patient aware of what to expect during his rehabilitation period. Furthermore, the collaboration of the patient is a key to achieve the optimum outcome. And we all know that in our days we do pay a lot of attention to ask the patient to do more and more by his own. So we know very well that every patient is unique. So we should take into consideration the type of surgery, the associated injuries, the patient's profile, including her pain tolerance and her expectation, as we said before, in order to design the rehabilitation program, in order to design a tailor-made program for the patient. It should be noted that there is significant diversity in post-surgical rehabilitation programs, specifically regarding when exercises are initiated, the timing and extent of resisted exercises, and short and long-term precautions. As there is not enough scientific evidence about the rehabilitation protocols, the attention required by the physio, combined with the frequent communication with the doctor, will provide the best results for our patients. In this systematic review that was published in May 2019 in Journal of Orthopedic and Sports Physical Therapy, it was a systematic review with more than 3,000 references, and listen, only 16 met the inclusion criteria for quality assessment and analysis. From them, only one out of these 16 was a randomized controlled study, and 12 studies, listen carefully, was based on expert opinion. So even in our days, the majority of rehabilitation protocols are still based on Hanks and Neal's original work in the mid-70s, with no clinical data to support a preferred rehabilitative strategy. So if we want to see our patient smiling, besides all the aforementioned, we should never forget to smile as well. Thank you very much for your attention.